So very good morning to everyone. So basically, I'll take you through, how to identify and modify these risk factors. I do not have any financial disclosure. So the objective of my talk today is to identify what are the lifestyle modifications and probably, what we can take away as a recommendation at the end of this particular talk. So if you look at the myopia and its progression, we are all in kind of, the epidemic, or you can call it as, the pandemic. It is also important to identify the basic lifestyle factors to mitigate it. And environmental factors, they are actually driving the rise in the prevalence of myopia. So it is our role as an ophthalmologist that which worthwhile lifestyle modification, and for that matter, the habit that can be adopted, in our day-to-day practice. So we have a WSPS consensus statement that is very much in place. What does not work, or what is, less effective versus, what appears to work. And I am going to focus amongst, these three things. The first, behavioral intervention. Already, these are the two major challenges as a care provider. Identify which lifestyle factor has been scientifically shown to be associated with myopia. It's not just like, the group of people, they are saying, okay, this is a risk factor and let adapt it and, advise to our patient and parents. Secondly, the recommendations that are they are realistically achievable for the child and the family. So, how do you identify the risk factors for myopia onset and progression? Probably for pre-myopes, you can take family history, look for the visual environment, how's the binocular vision of the child in terms of, the accommodative convergence, like isophorias, accommodative lag, and also whether the child has an intermittent exotropia, and what is the current refraction. So current refraction is also very, very important at baseline. If they are, less hyperopic, that means they have very high chance probably they would go into, the early myopia, or called as a pre-myopia. So we have to actually, as a preventive mode, we have to focus on this group of patients. Myopia progressors, you can look at the age. Younger the child becomes myopic, the faster they will progress in the future. So that is also important question you need to ask or think about. How much is the age at presentation. Family history, again, two myopic parents, probably the fastest progressor. Children with one myopic parents, comparatively less progressor. How's the visual environment, ethnicity? As we say, there are certain studies which talks about, like, Asian ethnicity is also at a risk of, the faster myopia progression, and again the binocular vision. So I think this is very, very important. And with the courtesy of Dr. Gifford, if you see this particular photograph, that will help you to understand how important, the journey to the curtail or to slow down the myopia progression. So what are the lifestyle modifications? I think Dr. Siddharth has already talked about the importance of, how the genetic factors, they are going to be, the big feature, but we have to look at what is today we can do, and which is most important is, the if we intervene the lifestyle modification, probably we will be able to give, the effects for what we are trying to treat in terms of the optical therapy or a combination therapy, or in the future, the genetic therapy. So these are the listed, the known environmental risk factors. So the first amongst them is outdoor time and, the natural light. So this is widely supported by the literature. So the possible theories: dopamine release, stimulation of vitamin D synthesis. However, the protective benefit is not attributed to the physical activity, that we need to understand. It's not like, they should go outside and play. You can ask them to, even on laptop they can play, but then ask them to sit outside or sit under the sun. Then the magnitude of annual reduction in refraction. If you see this particular paper published by, the Pawan Varkicharla and group, so they have also looked at, the different aspect of outdoor environment. Considering overall the general benefit, I think it is better to recommend the outdoor time in the for every child. So this is another paper from a same group where they have looked at, open play yard versus under translucent artificial shade. Again, between the tall buildings, light intensity is similar to that of the indoor, or indoor classrooms with multiple large windows shows highest illumination. So I think these studies, they gives us more the volatile approach to guide our patient or parents when we advise them how they should get outdoor activities. Coming to the indoor light conditioning, again, this is very, very important. I think at what time, what is the lightning levels, and what type of, the lightning that you are using. For example, the LED. So I think LED lamps has a larger myopic refractive error or a longer axial elongation that has been shown through multiple studies compared to incandescent or, the fluorescent lamps that we do use for indoor. Near work and visual habit, again, this is has shown, like duration and nature of the work is very, very important, and what are their visual habits, that also we need to look at. Prolonged accommodative effort and peripheral hyperopic defocus is a possible mechanism. Shorter reading distance and continuous reading, they are more hazardous. So again, if somebody is reading a books without following, these standard, probably they are more or less same compared to the laptop. Near work and visual habits, this is something interesting I came across when I was reading this topic. So I think head tilt while reading is also we need to avoid, because here the mechanism is eyes are closer to the object, greater power use by the ciliary muscles, and that constant pupil contraction has a risk for the development of myopia. Digital habits, the exact contribution yet to be established. However, it favors an indoor lifestyle, like the near work, which is again these are the established risk factors. So you can call using digital gadgets that contributes indirectly for the myopia progression. So again, the the American Optometry Association promotes the WHO recommendation 1 hour per day for children under 5, and no time at all for children less than 1 year. So I think sleeps, there is evidence which is relatively new. Circadian rhythms is possible mechanism, considering the diurnal variation of axial length and refractive error. There are a lot of articles that has been published which has given the recommendation like insufficient sleep, poor quality of sleep, and late bedtime, probably they are the associated with the higher degree of myopia progression. Nutrition, again, this is completely a new area, may not be unreasonable to assume that they do have a similar association. The way we talk about like malnutrition probably cause the smaller organ size. In that context, yes, nutrition might have the role. However, this particular review by our myopia lab from Hyderabad, they have shown that that did not find any strong consistency. And being nutrition a complex space, and today's science is unable to find out the exact direct link. However, we need to keep open this possibility in near future. Again, school curriculum and education, I think we don't need to talk much about this, we are pretty much aware. I'll just directly jump on what are the recommendations. I think we need to adopt these strategies. For example, maximum outdoor times. Children who are not yet myopic is we need to focus upon. Why don't you play that game on your tablet outside rather than like you go and play around. Optimizing indoor lightings, I already talked about, probably LED, we should avoid it. Then near work, set as a timer, as Dr. Kane was asking, have you have the contract signed with the parents, you are going to follow this environmental lifestyle modification, and then only subject them to the optical or pharmacological therapy. Digital devices, encourage desktop over the handheld devices, and encourage healthy and regular sleep pattern, and avoid food which is highly refined sugar and fat, although there is no direct evidence. Thank you very much. And please do join us for this particular meeting, Eye on the Future. This time we are doing it in LV Prasad Eye Institute, Bhubaneswar campus. Thank you very much.